So in the text we saw that the hamstring is often injured in an eccentric action, and it's the eccentric failure which can be the deciding factor. So when we're trying to prevent re-injury, in terms of getting a specific adaptation to the muscle, we need to load eccentrically. Now we can do that in a controlled fashion, but we need to gradually increase to form a bridge between the controlled element and what's going to happen out on a wet pitch where it's going to be uncontrolled. So we've got 3 exercises that we can use. The first one is called the diver. In yoga, it's called one of the warrior poses, so Virabhadrasana 1, and in ballet it's called an arabesque. But essentially what we're doing is we're leaning forwards, taking the weight on the injured side. So you're going to take the weight on this side, so I'm just going to come in front of you, and all you're going to do is lean forwards and bend from that leg. So just as we did before. That's it, and come back again. So I'm supporting her to start with. Just do that once again. And now my hands are here, and you're just going to touch my hands. That's it, and again. All right. And at home, if she's finding that difficult with the balance, so all she can do is just lunge forwards, dive forwards to touch the stool. So just try again. So you're just going to put your hands forward and down onto the stool. That's it, and then back again, forwards and down onto the stool. So it becomes a little bit easier. And we can vary that left leg. So sometimes we'll do it with the leg fully locked, and sometimes we'll do it with the leg slightly bent. Alright, so our second exercise is a modification of a normal stretch. So if you could lie down onto your back. So with our stretches, we have 2 stretches that we often would use, which would be our straight leg raise and our active knee extension. So we take the active knee extension and we perform it now, not so much as a static held stretch, but as a continuous motion. So if you pop your hands behind your thigh, and all you're going to do is to keep your thigh still and just try to straighten your leg and bend it down again. And just perform 5 of those repetitions. So this is our extender movement, where she's going into that stretch position and then releasing. Into the stretch position and then releasing. And we can do that to repetition to gradually increase that tissue tolerance to lengthening in an eccentric action. All right, and then finally, if you stand yourself up, there's going to come a situation where she's out on the hockey pitch and she suddenly slides on wet grass, so we need to prepare her for that. So we're using a glide plate, and at home the athlete can just use a piece of shiny paper on a carpet, or they can use a cloth on lino, for example. One foot goes onto the slide plate, and all we're doing is sliding forwards. So we're doing this action. Now that movement initially just prepares the hamstring to the action. And then I'm going to transfer, so it's the slide back, which is now going to put the stress onto this right hamstring. So I'm coming from there and I'm sliding back. And this action is then on my bent knee, and eventually I can support myself with the stool, and then I can come back onto a straight leg. So let's just have a go. So if you pop yourself around and put your right foot onto the slide. So I'm going to support, and at home they can use just a banister rail or something, or a ballet bar at the gym to support themselves. So the right leg is working, and all you're doing is kicking forwards and coming back again. Kicking forwards and coming back again. All right, so place your right foot on the floor, left foot on the slide plate. So it's still the right foot which is held. So the right foot stays still, and then you kick back with your left. And then come forwards and back and forwards. So that's working with the knee and the hip slightly flexed. Can you do it with your leg, with your right foot straight, your right leg straight? Just give it a go. That's it. And come back again, and again, and come back again. Okay, so that's our our slider exercise, which is using our eccentric control and the strength that we've developed with additional exercises into a less controlled movement.